In your health headlines, it's one of the most common reasons people see their doctor, a persistent or chronic cough. Now, you might be surprised how long a cough can actually last. So what are the causes and what can be done? Dr. Mitchel Goldman with UCSD is here now to talk about this. Good evening, doctor. Thank you for joining us.
Good to be here.
Right, I know. You know what, though? It's amazing to me when I was researching this for this interview, how long people actually put up with a cough. I mean, what are we talking about time-wise when you say chronic cough?
Well, a chronic cough is a cough that usually lasts for about 8 weeks, 4 weeks in children. And upwards of 1 in 8 Americans has a chronic cough. And there's so many reasons that we can actually be coughing. Of course, if we have lung disease, if we're cigarette smokers, that's one of the conditions, asthma, exercise-induced asthma. But there are other conditions that are very interesting that we don't think about that causes cough. One is a post-nasal drip. So if you have a chronic sinus infection, post-nasal drip, that can cause a cough. And another one that we don't really think about is gastric reflux. So if we have heartburn, that can cause a cough. So those are the most common reasons for coughing.
Do cough drops work? And if so, what are the best ones to take?
Well, I don't know which one are the best, but basically what cough drops do is they allow you to sort of lubricate the mouth and the esophagus, the posterior palate we call it. And that is basically soothing. But there's no magic cough drop that works. In fact, there's no magic medication that works. There's some studies that show that slow morphine drips tend to decrease the incidence of coughing, and a drug called gabapentin, which works on the nerves, can also help. But you know, if you have a cough and it's lasting for 8 weeks, it's time to see your doctor to make sure that you don't have one of those 3 common things: lung disease, gastric reflux or heartburn, or sinusitis. And then sometimes, like in my case, when I had a chronic cough, it turned out that I had a thyroid cancer, so a large tumor. So things can really happen. Other reasons are anxiety. Anxiety can also cause a chronic cough. And so other treatments can be seeing your psychologist to help you through an anxious period of time.
So it's nothing to be ignored is the message here, because it really can be a signifier that something bad is going on that you need to address.
Yes, especially you're going to irritate all the people around you. But besides that, if it's lasting for more than 8 weeks, like in my case, thyroid cancer, for me, a doctor that of course thinks he knows everything, but I really didn't know everything until I took that chest x-ray and my doctor said, look. And so if it can happen to me, it can happen to everyone. So pay attention to a chronic cough. See your doctor if it lasts more than 8 weeks.
Okay, and I guess the good news here is that you are fine and it was treatable and everything is good, right?
And that was 10 years ago.
Oh, good. Well, that is good news to end on. Dr. Goldman, thank you so much for joining us tonight.
Thank you, Susan.